The following is a presentation on mental health parity in Oregon. It is presented by Frontier Nursing University Willow Group in PC 729. The views or opinions expressed in this presentation are solely those of Mindy Leroy, Andrew Thompson, and Paul Volsdorf, and do not necessarily reflect the views or opinions of Frontier Nursing University. Please listen to our presentation and approve Chapter 705 of Oregon State Law that deals with mental health parity. Parity, as it relates to mental health and substance abuse, prohibits insurers or healthcare service plans from discriminating between coverage offered for mental illness, substance abuse, and other physical disorders. Parity requires insurance to provide the same level of benefits. These benefits include visit limits, deductibles, and co-payments. Mental health can affect our emotional, psychological, and social well-being. It affects how we think, feel, and act. Mental health is important at every stage of life, from childhood and adolescence through adulthood. There is a wide range of mental health disorders. According to the CDC and the American Psychiatric Association, there are more than 200 types of mental health disorders. Some of the common disorders are depression, mood disorders, anxiety, and substance abuse disorders. According to Mental Health America, in 2018, 1 in 5 adults, or 18%, that is over 43 million Americans, have a mental health condition. And sadly, approximately 9.6 million experience suicidal ideation. Mental health disorders are real, and most Americans with these disorders lack access to mental health care. In 2018, 56% of Americans with mental health disorders did not receive treatment, and 7.7% of youths had no access to mental health services through their private insurance plan. As this map illustrates, mental health is prevalent throughout the US, and Oregon has the worst ranking. According to the Oregon Health Authority, mental health is prevalent as 1 in 5 adults suffered from a mental illness. Suicide is higher than the national rate for over 30 years. And in 2015, 762 people committed suicide. It is not surprising with the opioid crisis in the US that Oregon deaths from opioid overdose increased from 73 deaths in 2000 to 332 deaths in 2011. And in 2016, over 1,800 Oregonians died from alcohol-related causes. We need to protect our citizens with mental health conditions. By increasing access to mental health care in 2016, an evaluation was conducted, and there was significant provider-to-patient disparity, where there were over 5,600 patients to one mental health provider. This is unacceptable. These people are crying out for our help. We need to find a way to help them. What this legislation will do. By approving this legislation, it will increase access to mental health care, which studies have shown will improve outcomes. It will increase substance abuse treatment. Oh my goodness, I need to just stop.